Good morning, all. Today I am taking a lecture on uh, professional behavior in the healthcare setting. That includes the professionalism in the healthcare and professionalism in the medical practice. In which today we will discuss the two things. First one is general and specific etiquettes, legal and ethical issues, impact of the comfort of the patient's health, clinical laboratory setup practice, importance and methodology of cleanliness and hygienic practices, and laboratory discipline and confidentiality. These are the different topics that we will discuss in the today's class. Okay, so in this session, the outline is, the first thing is what is professionalism. Second one is of how we can this implement. So what is professionalism? That is approaches and dimensions of professionalism, and that is of clinicians, professional relationships and their duties. Okay, and disclaimer is the presentation is based on the professionalism and the ethics handbook of the for the resident, or we can say different different outline and duties of various countries. In India, various hospital that includes the government hospital as well as the private hospitals. Okay, so in in all overall in all, what is professionalism? The all countries they practicing. So we will discuss in the today's lectures. Okay, so duties and relationship. What is it? The country and the religion, that is of policy matter, which community we are serving. Clinics and the hospital, that can be by the particular country and what is the reason, and in which we can include the clinics and the hospital. So if we are running as an private limited, some hospitals are running as an commercial setup, so we can run as a policy maker, planner, and the manager, and they will also appoint the advocate, researchers, and educators. And in the clinics, they are the provider, manager, educator, and the researcher. So um, that could be the planning pattern of any organization of medical. Okay. Now, still you have to remember a role of model who influence our training program, and what are their qualities and what are their attributes. So in the question mark, what does the professionalism mean to you? If I'll ask you, what do you mean by that? So what should be your answer? Take a few minutes for that to write down your thoughts as defined in the descriptions. So what is the professionalism? You have to have and give the answer that it is not easy to define the profession, but it is likely to have all some of the following characteristics. That means the different things are when work together, so they will come under the professionalism. Like it is a vocational or calling that implies service to other. Could be the distinctive knowledge base which is kept up to date, and it is determine its own standard, set its own examination, and it's also the special relationship with those whom you have served, that is a patient, or in the hospital or in the medical college, it might be the students. Okay. Now, it is not easy to define the profession, but it is likely to have all some of the following characters, that is of patient and students. Okay. Now, some scientists, some you can say the some workers has given some specific uh, definition of that. So one of them is that is most acceptable, that is given by the American Board of Internal Medicine, that is a consulting those attitudes and behavior that serves to maintain the patient interest above the physician's self-interest. That means in this, the patient's self-respect is not very, physician's self Interest is not important, but the state of the patient's interest is very much important to you, to whom you are serving. Second definition of this is professional competence is a habitual and judicious use of communication, knowledge, technical skill, clinical reasoning, emotion, value, and reflection in the daily practices for the benefit of individual community that being served. Now, in the professionalism, two type of conduct is working together. One is a desirable, second one is of undesirable. So in desirable behaviors, these are the list like altruism, accountability, excellence, duty, honor, integrity, and respect for the others, and commitment to lifelong learning. That is desirable. You have to have these these type of your uh, habits that will give you the good results, or undesirable conduct, that is of abuse of the power. What it is, if I am the physician, if I am the senior nurse, so I am doing the pressure of the patient, I am abusing the patient, misbehaving the patient, this is undesirable conduct. Okay, bias, sexual harassment, we should not differentiate between the male, female and the transgenders, and breach the confidentiality. We have to maintain the confidentiality of each patient. And arrogance, we should have a polite. Greedy, we should not agree. Greedy, misrepresentation, impairment, lack of conscientiousness, and other. Now, the main thing that is comes under the this professionalism is, first is the altruism, that is giving a priority to the patient interest rather than the self interest. That means if you are working as a doctor, your self interest is in self interest is the last priority for yourself. Your first priority is your patient and patient interest. Second thing is the accountability, that means being answerable to the patient, society, and uh, profession. Number third is the excellence. Your work should comes under the excellence, and continuously effort to perform beyond the ordinary expectation, and commitment to the lifelong learning. Now, project professionalism, fourth number is duties. Free acceptance of commitment to the serve, that is undergoing inconvenience to achieve a high standard of the patient care. That means you requires the high standard of the patient care, so patient will get satisfied. Next is the honor and the integrity. We should have an affair about and truthfulness, and very straightforward to the patient with polite word, and keeping to one's work, its own work. So that is also required for the when we are dealing with a patient. Now, next is the respect for the other. First priority is we should have a respect for each and everyone, including the patient and their family member, colleagues, and the healthcare profession, those and the atmosphere or the colleagues or the seniors in which type of scenario in which we are working. It could be the students, maybe junior or the senior, or some training person also be there. Now, the concept of professionalism, that includes the values. What should be the value if you are the professional? First is the honesty. Honesty is a priority. Second one is, if someone is having you trust on you, you have to maintain. Third is you have to do the services, not give the false promises. Next is a commitment. Whatever you have uh, told to your patient and their family member, you have to follow the all these things. And communication, it should be in the proper way and in the transparent way. Next is the accountability. Whatever work you have taken, or what the work you have assigned by your senior, you have to have the accountable for that. You have to finish in the timeline. Lifelong learning. The work which you are doing under the seniors, that will be always a life learning training. Now, defining the professionalism when specific behaviors are unprofessional in the classroom or the clinical setting. So that is called the defining. Now, what could be the example of unprofessional behavior? When you are the medical student, you are the paramedical student or the nursing student, so the classroom setting students or the training and during the time of training, most acceptable behavior that you make you're a good person, and some unprofessional or unethical behavior could be there that will spoil your career as well as your dignity. So what could be its that is unprofessional? That is arriving for the class late or the leaving class early. If some emergency is there, you could do one or two times, but not always. For leaving early and coming late, being unprepared for the group session. When your senior says for the group discussion and for the group session, you have to have prepared for prepared before coming to your class. Not completing assigned task. Whenever you are given the task, you should complete your task within the timeline. Disrupting the class session, failing to attend the scheduled class session, and most important that you have to prevent yourself by the cheating in examination. Now, the using of mobile phone during the class, doing the chatting during the class, focusing on the test versus learning. Now, using content in advance and prejudging the content in the advance, and intolerance of the opinion of the others. That means if we are doing the discussion, everybody has his own discussion and point of view. So we have to respect the point of view of others, and we should not have an intolerance for the listening to others. Now, example of the unprofessional behavior, that is a uh, plagiarism. If you are doing the research work, you should not cheat the others' work. So that is called the plagiarism. And judgmental attitude of the favorism. If you are in the senior position, you should have an affair for that, not judge the person before before any result or the attitudes, or not give the favorism to anybody. Coming late, sloppers and slabby, abuse behavior, using mobile phone during the class. This is also comes under the unprofessional behavior. Next one is dressing inappropriately. When your dress code is there, you have to wear your dress code, and if dress code is not there, you have to wear the ethnic wears with decency. Okay. So that is also very much important is a dress sense. Avoiding the work and or responsibility, and if some responsibility is given to you, you are avoiding or not taking interest. Next is exhibiting the little empathy for the patient. You have an empathy for the patient that is not acceptable. Next is demonstrating the lack of sensitivity to the patient and cultural background. Uh, you have to have your sensitive to the patients, and if you are not sensitive to the patient, that is very much unprofessional, and not protecting the patient confidentially. If the patient is suffering from any disease that is not acceptable in the society, so you have to make the confidentiality to the patient, not making the fun, or you should not uh, gossip to others for their what, that is very much important. If patient is suffering from the some STDs, so you have to have very much confidential, otherwise the person is very much difficult to survive in the society. Now, clinical setting is about the faculty. If you are working as a faculty, if you are showing the favorism, so that is bad. Calling to attend the scheduled session. If you are made this session schedule for the month basis, for the year basis, you have to have follow for that. If you are following that, that is unprofessional. Using inappropriate language or the behavior. All the time the faculty member or the teacher is the ideal to the student. So we have to follow all these things for their respecting of their post. Asking, learn to perform personal tasks, for example, picking up the laundry. Now, role of the doctor within the health service and personal development. There is a different role of the doctor within the health service. What it is? Number first, understanding of the now understanding of the healthcare system. That is the role of doctor. Understanding of the clinical responsibility. Then appreciation of the doctor as a researcher. If your doctor is working to the patient and working of the same type of patient, and if he or she wants to do the want to do the research, so we have to appreciate. Then appreciation of the doctor as a mentor or the teacher. If the doctor is telling to you something about the your goodness as a teacher or as a mentor, so that should be also appreciable. Appreciation of the doctor as a manager, including quality control. So quality control management is required. Uh, that is a that comes under the good professionalism. And last one is a teamwork. So that is the role of doctor. And next is a personal development, that is of lifelong learner, self awareness, self confidence, self regulation. So the self regulation is very much important. What is the self regulation? That is the self care, self control, personal time management that is required for the development of yourself. Okay. Now, motivation, achievement drive, commitment drive, inactive drives, and career choice. These are also the part of that. Now, sign and symptoms. The work of the projection professionalism describe the unprofessional behaviors in the terms of several broad categories in sign and symptoms. What are that? They are the abuse of the power. Second is arrogance. Third one is of greed. What is the abuse of power? That abuse of the power is that is the interaction between the patient and the colleagues. Bias and sexual harassment and breach of the confidentiality, that is the abuse of the power. Second is the arrogance. Arrogance means offensive display of the superiority, that you are the superior. Your behavior always tells that you are the arrogance. And self importance, I am is something, your opinion is nothing, that is a bad sign. Third one is the greedy, when the money becomes the driving force for each and every organization or the for the doctor, that is called the greedy. And that is not good for the institution as well as for the doctor also. Fourth one is a misinterpretation, that means lying. Somebody is saying something and I am listening something and I am understanding differently. So that could create a chaos, and that will comes under the unprofessionalism. So lying, which continuously failing to tell the truth. Fraud, which is consciously misinterpretation of the mental fact with interest or mislead. Next is implement, any disability that makes prevent the physician from discharging his and her duty. That is called the implement. Next is a lack of consciousness, that is failure to fulfill responsibilities. Next is conflict in the interest, self-promotion, advertising, or unethical collaboration with industry, acceptance of the gift, misuse of the services, overcharging the inappropriate treatment, and prolonging contact with patients. Main thing is that we have to have charged whatever we have treated, what is required to the patient, not more than that for the part of greed. So this is also comes under the uh, unprofessional practice. So now, physician's duty towards the colleagues. What are the physician duty? To deal with an act towards the colleagues in the good manner, or physician duty, and he or she can expect same way for herself and himself too. ठीक है. Now, to avoid the direct criticism of his colleagues in front of patients, that means if the person, one patient that comes from comes under the referred cases, so we have to the doctor should have a respect to their colleagues and not criticize their colleagues, not indulge in the defaming the honor of his colleagues, to exert every possible efforts to educate the colleagues. Now, next is respect the differences between the colleagues, that could be the sex, culture, and beliefs. They might be the different culture, they might be the different sex, they may be they are believers, they believe in some different their religions. So we should respect for all. The physician should respect other non-physical medical professional colleagues and appreciate their role in the healthcare of the patient. Generally, we are seeing that doctors, they are not take care of non-medico. So that is not a good practice of the physician. They should have they should have taken take care of the person, because he is a team leader of the unit. He or she must report the incidents in which the colleague should be injured or any in trouble. Now, what are the clinical duties towards his and her profession? The clinical duties are the respect the owner of professional. Okay, develop him and herself to develop the profession through the CME. That means the continuous medical education, research, and publication. So, for that is a good practice in which the different department of medical organization, they should have discuss the case once in a week as a CME and take a part in the research and the publication. Now, adhere the standard of the practice. Next is abstain from any behavior, action that question his and her credibility and their honesty and towards the patient and their family. And they should have avoid the request or frame of the account of professional ethics and standards. So, clinician duties towards their profession. Now, to take the appropriate procedures when he comes to know that one of the member of the health team is sick. If the person is sick, ignorant, and neglected to his duty in the furtherance of the protecting the patient in first place and the medical profession too. That means if the one doctor, if the person is treating within a one doctor, if the doctor is unfit, so second doctor should take the responsibility towards the patients, because patient is a priority, and any kind of dispute and any kind of negligency, that is not acceptable for the during the treatment time. The physician should refrain when dealing with a patient from any act or conduct that would infringe his honesty and integrity. That means the physician should maintain their honesty and integrity and work on that two features continuously for long time, uh, till he or she is working in the organization, to avoid the seeking fame as expense of that. Now, the clinical roles towards the community, what should be? The positive interaction with community affairs, the community reporting the responsible epidemic disease and improves the health in the community, and rational use of the healthcare institution resources. Next is effective contribution of the development of policies and health system that responds to the community need and access to the healthcare. Now, what is the clinician role towards the community? Clinicians should be having a role model for their attitude and religion. And second, the promotion of the health equity among the social members. And clinicians should maintain the health resources and ideal utilization of such resources. His skill and his knowledge of clinician is should improve, and he and she has to be expertise up to the standard for the treating of the patient prevailing in the society. Now, summary point is that being a clinician is about being part of team. Uh, you have to write and duties as part of team. Then center of your care is your patient, not your ego, not your bank account. This is all about the for the physician. Many of the positive attitudes and the skill can develop when we are taking the training and the self development programs, and developing and adhering to the standard develops and improves the healthcare and enhancement public trust in the health system. We have to respect our patient and colleagues and community, okay, to maintain the better relationship. Now, what is it? It is very much important to everyone whenever you are, sorry, just a minute. Okay, it is very much important to everyone whenever you are co-worker or the patient, you expect and deserve to be in the professional atmosphere. So you have to you, that is very much important. If you are the co-worker or the patient, so you have to have fulfill the desire of patient, and you have to maintain the proper professional atmosphere all around that. Now, with professionalism, everything matters. Overall appearance, that is also reflects your personality. That man to be shirt and skirt, that is a part of your dress code, and hair should be in the proper. Jewelry should not be allowed, and tattoo should not be. If any tattoos is there, you should cover when you are doing the practice. A nail should be short and clean. The use of the personal protective equipment should be used if you are treating the disease of communicable patients. So lab coat, goggles, gloves, and face masks are required whenever you are using the patient suffering from the communicable diseases. Okay. Okay. Next, the professionalism is a more than the clothes and the knowledge. We have to use the proper equipment and training to maintain our attitude. So the professionalism is a healthcare in the very much important because patient need to be able to trust the physician. Professional in the healthcare shapes the public perception toward the physician, and professionalism brings people together and helps them to get along with one and another. Professionalism keeps the patient satisfied and happy with their physician. Okay. Now, very much important is the cleaning and cleaning of our environment, which we are doing all these things practices. So, determination of the environmental cleaning procedure, we have to care including frequently method, different method we have to use because communicable disease will spread and everybody is infected. So, what is decontamination? Process which removes and destroy the contamination so that the infectious agent do not multiply. And there are three levels of the decontamination: cleaning, disinfection, infection, and sterilization. So the disinfection is by the detergent, and sorry, just a minute. Disinfection is a detergent, and that acts similarly as an a soap. and disinfectant is a condition is capable of disinfection. Third one is a disinfection, that's a process used to reduce the number of microorganisms but not usually the bacterial spores. So that is the three categories of contamination, decontamination things. The cleaning, that cleaning of the patient bath, commode, beds, and ensuring the effective disinfection and installation. Cleanliness is a very much important to remove the organisms, remove the dirt, dust, and debris and spillage. The detergent can be used, that is of low risk item, that we can use the natural liquid detergents. Cleaning is a low risk equipment, and uh, commodes, bath, beds, and wheelchairs are uh, beds and wheelchair. Okay, so wheelchair should be cleaned daily according to the manufacturer's instruction. So all parts should be having a cushioning. Mattress check. We have to clean mattress. It should be checked monthly to remove the cover and inspect for all inside the surface for the cleaning. Now, common high-touch surface include the things that is, you can think that in the chart you can study. Okay, bed rail, ivy poles, sink handles, besides the table. These all these things are. Now, general patient area, that is the outpatient, ambulance care ward, green inpatient ward with a patient admitted. The three type of the cleaning are required for the area: routine cleaning, terminal cleaning, scheduled cleaning. Routine cleaning, as you know, that patient admitted focus on the patient zone, so cleaning is required, and frequency at least once in a hour, 24 hours cleaning. Terminal or the discharge cleaning in the patient ward if the patient is discharged, so we have to do the cleaning for that. Terminal cleaning is that is called. Next is patient transfer or the discharge or the cleaning disinfection is required for the shifting of the another patients, that is remove of the facilities liner or inspect the window treatment, that is cleaning is required. Schedule cleaning, that is required with the time to time and different intervals. Recommended, that is of weekly clean and monthly and annually. High surface and walls, bedrooms, window blinds, beds and window curtains. Spill of the blood of the body fluids should be in the regular basis. Cleaning should be there in the regular basis. And example of the cleaning is strictly for the environment of the surface. Terminal based precaution isolation ward. It could be the airborne, contact and droplets. This type of cleaning is also required. Non-critical patients, care equipments, like blood pressure machine and other things. Summary of the environmental decontamination: self and frequently the general fittings and ensure the blood spills. Okay. For the lab safety policy: general safety, electrical safety, chemical safety, and personal uh, summary, sorry, and housekeeping. Okay, these are the general safety. You can see that we showed for the fire alarm, full aware for the building evacuation if it is any emergency. Okay. These are the general safety which we have to follow by the using of glassware and something. Important is we have to avoid the um, clinical substances which can be give the harm to the person. Chemical safety, personal protection safety. When we are working that, we have to use the goggle, gloves and other body covering. Always tie our hairs in the back side. Make sure our loose clothing and dangling jewelry should not be used at that area. Never wear short shirt and skirts when you are working. So the dress code is very much requirement, and housekeeping safety always always in our housekeeping area. So that is also very much important, housekeeping safety. So this is all about the today's lecture. Hope for that you are all are able to understand about the different safety precaution, your dress sense, cleanliness, environmental policies, your personal behavior, professionalism, everything that is included in the today's lecture. Thank you very much for being with me. Have a nice day. Have a good day.